Hello and welcome to Sports Injury Clinic's rehabilitation program for Osgood Schlatter's disease. So Osgood Schlatter's disease is a common problem that quite often happens in adolescent children, often between the ages of sort of 10 to 15. What generally happens is that you get pain at the top of your shin bone, which is this sort of bony prominence just below your kneecap at the front. Quite often be very tender to touch and will also be sore during exercise, when you contract your quad muscle, so your thigh muscle, or if you go into a sort of squat position. Annoyingly, with this type of injury, the symptoms come and go. Sometimes they can be bad, sometimes they can be good, and it can make the management of it quite difficult, because if you're an athlete, then one day it can feel quite positive, the next day it can feel really, really sore, and you kind of keep going through and you train and then you don't train and you don't really ever kind of get on top of the problem. So it's worth getting an opinion if you're not quite sure about the diagnosis, because or once you get diagnosed as having Osgood Schlatter's disease, that you take the appropriate measures to get yourself back to full fitness. Otherwise the problem will just drag on and can make things a lot worse. Some of the other sort of signs and symptoms that you might see is that it can become swollen. It can become quite prominent, so you end up with quite a big bump at the front of your knee, sort of just at the top of your shin. In severe cases, it might be worth, if it looks particularly bad, seeing your GP and getting an X-ray to confirm the diagnosis, because there are other issues that can be causing similar sorts of problems. So it's worth just getting it checked out if you're not quite sure. One of the other key things that happens with this is that the pain from the Osgood Schlatters can cause wastage in your quadricep muscles. So part of this program is designed to return your quads back to where they should be. It's a difficult thing because the body naturally, as a natural response to the pain, switches muscles off, and in some ways we've got to kind of override that to get the muscles working properly, because it's no good having pain and weak muscles. You're much better off having a strong quad rather than a weak quad, even if the pain is still hanging around a little bit. The most common question is, how long is this going to take? And I wish that I could give you a definitive answer, but the honest answer is that everyone's different. The acute pain that you feel in your knee will normally settle within sort of 48 to 72 hours, but it can take up to 2 or 3 weeks of complete rest to let the symptoms settle. But it's important that you allow it to do that, because the pain and swelling and inflammation that you're feeling there is there for a reason. So it's really important that you take notice of that and you respect that and give it the time that it needs to let it calm down and settle down before you start trying to work it. The key thing about Osgood Schlatter's is that what we're trying to do is twofold. One thing we're trying to do is get control of the pain and the symptoms, and then the second thing that we're trying to do is build some strength and capacity into your quadricep muscle, which is your thigh muscle, which ultimately will help you manage the symptoms much better going forward. The acute phase, and you've let the symptoms settle down a little bit, it is possible that you can modify your activity and continue to train. I'm not completely against that by any means, but it's worth noting that if you do that, it's likely that it's going to take a little bit longer for your symptoms to completely resolve. So there's a little bit of a decision to be made, in either that you completely rest the knee, give it a chance to calm down and work through the rehabilitation program, or you can look to modify your activities and start bringing in the exercises from the program alongside it, but the chances are it's going to just sort of extend the time it takes for the symptoms to settle down. One of the other questions I often get asked is, will it come back? And the answer is that it could do, especially during adolescence and especially during growth spurts, where in real terms what's happened is that the bones have grown kind of quicker than the muscles have been able to tolerate. It is possible for it to come back. So it's not out of the realms of possibility that you could do all of the rehab, been as diligent as you possibly could, looked after it, respected the symptoms, have no symptoms for a period of time, and then suddenly out of the blue the symptoms come back. Now unfortunately that's part of the process, and what my suggestion would be is, if that's the case, you revert back to the beginning, you revert back to phase 1, you revert back to doing the acute management and press on from there. In terms of diagnosis of Osgood Schlatter's, a lot of people asked me as well, you know, is it obvious? And the honest answer is, yeah, normally it is fairly obvious that someone's got Osgood Schlatters. You know, the symptoms and signs are quite clear. If you are in doubt, it is possible to speak to your GP. You can get an x-ray, which may or may not confirm it, but generally the signs and symptoms are enough. And like I said previously, if it's painful at the top of your shin, below your kneecap, it feels tender to touch, and it's sore when you run or you squat or you contract your quads with a bit of intensity, then chances are it's Osgood Schlatters and that you should probably follow this program. Phase 1 is basically about trying to get control of the symptoms. Now, there are a lot of reasons why you may have Osgood Schlatters, but what we're trying to do in this phase is get control of the symptoms in order to able to progress us onto phase 2, where we can start working a little bit harder and getting a little bit more strength into the muscles. We split it up into a few different sections, section 1 being treatment. And what we mean by that is that you can apply a cold pack to the area, you can use taping techniques, you can use anti-inflammatory gels, you can rest the area. All of these things are going to help just let the knee calm down. We really want to get the symptoms and the pain and the inflammation gone, so that therefore we can start working forward and getting a bit of strength into the leg. Quite often with Osgood Schlatters, the issue comes from an imbalance really with muscle tightness around the knee being one of the key factors. So in phase 1 there's a fairly heavy emphasis on stretching and foam rolling. There's 4 stretching exercises and a foam rolling program to follow, and the idea is that we're trying to loosen off any tightness and imbalance within the muscles around the knee, so that we can free off the anterior or front part of the knee and give that area a little bit of relief. We've also added in 4 strengthening exercises. Now, these 4 strengthening exercises aren't specifically related to the tibial tubercle, which is the area which gets inflamed during Osgood Schlatters. What we're trying to do is we're trying to work on areas around the knee which we think will help with that muscle imbalance and will help you going forward. So it includes exercises for your glute, for your calf, things like that, which we're going to hopefully help you move better and strengthen areas which may be weak, which may be having an impact on the knee. In terms of treatment, one of the key components of the treatment protocol really is that you ice the knee. Now, there are various ways in which you can ice the knee, but the key thing is really what we're looking for is that you put ice on that area where it's sore for a minimum of 10 minutes, probably ideally 20 minutes, and you can repeat that every 2 hours. Now, I understand that some people, you know, especially if you're an adolescent, you're a teenager and you've got school and things, it may be that you have to work around that. But my suggestion would be that whenever you get a chance, as soon as you wake up, as soon as you come in from whatever you've had to do, and then at 2-hour periods throughout the evening after that. One of the other treatment options available to people is that you tape the knee. So there are various different types of taping you can use to try and offload that painful area. There are also various straps and braces that you can buy which have successes. One other key component in this acute phase is massage. There's 2 different types of massage that we recommend in this phase. So one is the application of an anti-inflammatory cream to the area. Now, you can do that up to 4 times a day. So you just get a sort of decent dollop on your hand, rub it into the area and leave it to soak in. You can do that up to 4 times a day. The other thing that we recommend doing in terms of soft tissue is you can get a quad massage or an iliotibial band massage. So that's the outside part of your quad. All of those things come in, they attach into the front of the knee. If you can get them released, it'll take just a little bit of pressure off that and it should give you some symptomatic relief as well. You can do that once a day. One other thing that I think is really important in terms of treatment of this is foam rolling. Now, you don't need to foam roll the actual area, so we're not asking you to go over the area that's painful with a foam roller. That would be incredibly sore. But what you can do is you can foam roll your quad, your hamstrings, your calf and your iliotibial band, which we've got demonstrated, and all of that will just take away some of the tension around the knee, which will hopefully just free up a little bit of the tightness at the front and make it feel a little bit more comfortable. So this is a calf stretch, back leg straight, heel on the floor. Going to look to hold this somewhere around 30 seconds, repeat 4 or 5 times. So this is a soleus stretch. This is going to get the lower part of your calf complex. The idea is that you have your affected leg behind you with a bend in the knee. You're going to hold it for 25-30 seconds, repeat it 4 or 5 times. This is a glute figure of 4 stretch. You're literally going to put the foot across the knee, bring it up towards your chest, hold it for 15-20 seconds, and then swap sides. So this is a hip flexor stretch. The one that's being stretched is the one that's bent at the back. You're going to hold this for about 15-20 seconds. If it feels comfortable, you can grab hold of the trail ankle and hold that for 15-20 seconds. And if that feels comfortable, you can bring up the opposite arm to give yourself a full hip flexor stretch. So this is a standing quad stretch, just to stretch out the quads muscles. You're going to hold this for around 30 seconds and repeat it somewhere between 4 or 5 times. Call this variation a clam exercise, and essentially you've got your knees bent but you want your ankles in line with your hips and you're just opening your knee away from the other leg. This is a straight leg raise in external rotation. This preferentially activates the VMO muscle. You've got your foot turned out 45 degrees, toes pointing outwards, looking to lift the leg 6 to 8 inches off the floor, somewhere between 12 and 15 reps. Slight variation on the straight leg hamstring bridge is the bent knee version. So you're going to preferentially activate the distal part of the hamstring. So this is a standard bodyweight gastroc raise. It's working the calf muscle. You'll probably start somewhere around 8 to 10 reps, building it up towards 15 in sets of 3. In order to exit phase 1, it's really important that you've taken at least 72 hours of complete rest. If you haven't done that, then I recommend that you take 3 days of complete rest as a minimum. After that 3 days of rest, in order to move on to the next phase, you should be pain-free to touch. So pain-free to touch that area. You should have a pain-free quad stretch with no discomfort at all. You should be pain-free on sort of normal activity daily living. So things like walking up and down stairs, walking around, getting in and out of the car, things like that. You should have also been applying ice for around 20 minutes every single day to the knee.